Hi, I'm Christopher Ramirez. I'm the executive director of Together for Brothers in Albuquerque, New Mexico, and I'm excited to be applying for the Culture of Health with Robert Wood Johnson Foundation. Um, One of the things that we have realized in the last 2 years of implementing a health impact assessment around transportation and health equity is realizing how much of a barrier transportation is for young people. Having done youth organizing for 20 years, I recognize that transportation has always been a limiting factor in young people's participation in after school, co curricular, and other activities. But the HIA, over the past 2 years, doing the literature review, doing surveys with over almost 400 youth and focus groups and interviews, really helped us to understand how access to education, access to employment, access to recreation, and promoting healthy habits as social determinants, how those really impact the health and other outcomes of, in particular, young men of color here in Albuquerque. And as we collected and analyzed data, and I built capacity by coaching and mentoring young men of color to do that, the things that we've learned are that there's a lot of misinformation, a lot of people, including community partners and decision makers, even most recently at the state legislature, who think that young people already have free bus passes, but also that folks that don't understand why transportation actually is important, or why in a bus system where we only charge 35 cents per rider for each ride, why that is a limiting factor to say that that shouldn't matter because it's so cheap, where we have a large number of young men of color who come from families that live in poverty, that 35 cents or 70 cents or $1.40, if you think about going back and forth to not only school but to community activities and work every day, does become a huge barrier. Even the $15 youth bus pass, the monthly bus pass, is out of reach for many of the young people we work with. And so as I look at the culture of health and this opportunity to work with others to understand transit and health equity, I think it's important that I continue to learn about community organizing that's really framed within a racial and gender justice, and then also look at opportunities to transform the youth leadership model that we have that includes some circles and cohorts. And I'm excited about the opportunity for making my community here in Albuquerque healthier, but also working with young men of color to do that for them and their families.